In this video we will talk about ginger, health ginger benefits and side effects. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. Ginger has enjoyed a soaring, global popularity in recent years. More and more people are becoming aware of the significant culinary and medical benefits of ginger. Ginger is a plant with leafy stems and yellowish-green flowers. The ginger spice comes from the roots of the plant. Ginger is native to warmer parts of Asia, such as China, Japan, and India, but now is grown in parts of South America and Africa. Ginger is commonly used for many types of nausea and vomiting. It's also used for menstrual cramps, osteoarthritis, diabetes, migraine headaches, and other conditions. In foods and beverages, ginger is used as a flavoring agent. What is ginger? Ginger comes from a flowering plant known as Zingiber officinale. But ginger, as we know it and see it in grocery stores and markets, actually refers to the rhizomes or roots of the plant, which is why it's sometimes called ginger root. In manufacturing, ginger is used as for fragrance in soaps and cosmetics. One of the chemicals in ginger is also used as an ingredient in laxative, anti-gas, and antacid medications. The most common edible ginger roots are yellowish in color. However, there is also blue ginger, red ginger, and white ginger. And you can sometimes find different species of baby ginger, which are actually the young roots of a ginger plant and are often pink and cream-colored. How does ginger works? Ginger contains chemicals that may reduce nausea and inflammation. Researchers believe the chemicals work primarily in the stomach and intestines, but they may also work in the brain and nervous system to control nausea. Where does ginger come from? Ginger plants prefer hot weather in tropical or subtropical climates. Most ginger originates in Southeast Asia, where it first grew wild in rainforests. Even though it's now rare to find uncultivated ginger in Southeast Asia, most of the ginger consumed worldwide still comes from that region. China, India, Nepal, and Thailand are the largest producers of ginger. Nutrition facts of ginger. If you've ever tasted a piece of fresh ginger, you know that it packs an intense flavor punch. The more mature the ginger root, the stronger the flavor. Because it's so strong, you don't need a lot of it to flavor a dish. But when it comes to ginger's health-boosting properties, a little bit goes a long way. Ginger is high in vitamins C and B6, along with magnesium, potassium, copper, and manganese. It's full of both fiber and water, making it good for gut health and weight maintenance. It's also low in calories and high in phytochemicals, the active compounds in whole plant foods that protect your health. Most of ginger's health benefits appear to come from its abundance of polyphenols, which protect the body against oxidative stress. Ginger contains three main polyphenols: gingerols, shogols, and pyridols, in addition to being high in antioxidants. Health benefits of ginger. 1. Nausea and vomiting caused by drugs used to treat HIV/AIDS. Antiretroviral-induced nausea and vomiting. Research suggests that taking ginger daily, 30 minutes before each dose of antiretroviral treatment for 14 days, reduces the risk of nausea and vomiting in patients receiving HIV treatment. 2. Menstrual cramps during the first 3 to 4 days of a menstrual cycle modestly decreases pain in women and teens with painful menstrual periods. Ginger was given for approximately 3 days starting at the beginning of the menstrual period or at the beginning of pain. 3. Osteoarthritis. There is some evidence that taking ginger by mouth works as well as certain drugs such as ibuprofen and diclofenac for pain in hip and knee osteoarthritis. But conflicting results exist. Some early research also shows that ginger gel applied to the knee or ginger oil massaged into the knee can also relieve osteoarthritis pain. 4. Morning sickness. Taking ginger by mouth seems to reduce nausea and vomiting in some pregnant women. But it might work slower than or not as well as some drugs used for nausea. Also, taking any herb or medication during pregnancy is a big decision. Before taking ginger, be sure to discuss the possible risks with your healthcare provider. 5. Anti-cancer gastrointestinal cancers are among the most common and lethal types of cancer in the world. But a 2015 review showed how ginger had been used to both prevent and reverse gastrointestinal cancers. Test tube, animal studies, and human studies all suggested that ginger suppresses the growth of cancer cells and, in fact, causes them to self-destruct, a process known as apoptosis. Ginger could even enhance the anti-cancer effects of a chemo drug, 5-fluorouracil, which may encourage further human studies on its use as a cost-effective, complementary cancer treatment. 6. Antiemetic. Perhaps ginger's most well-known health benefit is its effectiveness against nausea and vomiting. In many countries, especially China and India, a ginger tonic or tea has been given to help calm digestive discomfort and disorders for thousands of years. It's thought that the polyphenols gingerol and shogal are responsible for ginger's stomach settling effects. However, there are also over 30 years of research dedicated to this particular application of ginger. Multiple studies show its effectiveness against nausea and vomiting, especially in relation to both pregnancy and chemotherapy. In studying ginger's effects on chemotherapy-induced nausea and vomiting, a double-blind cancer patient trial reported significant reduction in acute nausea. Participants received either a placebo, half a gram of ginger, 1 gram of ginger, or 1.5 grams of ginger. All patients who received any of the ginger doses, at all 3 levels tested, found nausea relief. 7. Treats and prevents harmful gut bacteria. In addition to helping with nausea, ginger also aids gut health by targeting certain bacteria with its potent antibacterial activity. A recent 2019 study in Advanced Pharmaceutical Bulletin concluded the use of ginger was helpful in treating functional dyspepsia as a result of the bacteria H. pylori. In addition to easing or eliminating uncomfortable symptoms, ginger therapy completely eradicated the harmful gut bacteria in half of the test subjects. That's a big deal, considering H. pylori is notoriously difficult to get rid of. 8. May protect against radiation. Radiation is a commonly used cancer treatment that has some very problematic side effects. One of them is that it increases oxidative stress within the body and can harm internal organs. In an effort to mitigate these side effects, a none-too-kind animal study, performed in 2017, explored whether ginger might work as an anti-inflammatory and antioxidant agent in the body. 9. Pain reliever. Ginger also works as a multifaceted pain reliever. The results found ginger worked equally as well, but with fewer side effects. Plus, it's a lot cheaper. Ginger has also received acclaim as a natural pain reliever for menstrual cramps. A randomized, controlled trial on 120 female Iranian students with moderate to severe menstrual cramps tested the effects of ginger to see if it would help. The students received either 500 milligrams of ginger powder in capsule form or a placebo 3 times a day. They further split into groups that received the treatment either 2 days prior to menstruation plus the first 3 days, or the first 3 days only. In both cases, where ginger was given, there was a significant reduction in pain, compared to the women who took the placebo. Because it works as an anti-inflammatory, ginger also shows promise for muscle and joint pain. One study showed that the daily consumption of heat-treated ginger relieved exercise-induced muscle pain. And other studies have examined ginger's effect on osteoarthritis, a painful degenerative joint disorder, with moderate but promising results. 10. Cardioprotective benefits. Daily ginger consumption decreased the risk of both hypertension and coronary heart disease. Maybe we should start saying, a dose of ginger a day keeps the heart doctor away. 11. Neuroprotective. Ginger might be one of those neuroprotective foods you'll want to add to your diet. In vitro tests using one of the bioactive compounds found in ginger, gingerol, showed potential anti-inflammatory effects by acting on cells that essentially turn on cells and proteins within the brain that cause neuroinflammation. 12. Could help balance blood sugar. Ginger might also have value in supporting blood glucose control. Patients with type 2 diabetes saw a significant improvement in these levels while taking ginger, suggesting that ginger could have a long-term positive impact on blood sugar balance. Side effects and safety of ginger. 1. Gastrointestinal discomfort. Recommended doses of ginger and those amounts used in clinical trials are usually between 170 mg to 1 gram of powdered ginger per day. Studies show that consumption of more than 6 grams of powdered ginger at a time can cause gastrointestinal symptoms such as diarrhea, heartburn, and upset stomach. A tablespoon of ground ginger weighs about 6 grams, that's equivalent to about 2/3 cup of fresh ginger. So if you do decide to consume a lot of ginger, you might not want to go above 2/3 cup of fresh ginger, or 3 teaspoons of ginger powder, per day. And frankly, if you did decide to eat that much, I'd have to wonder about your taste buds. Because ginger is, after all, a spice. 2. Central nervous system depression and arrhythmia. Although ginger's blood pressure lowering effect is beneficial to some people, in others, it can cause blood pressure to drop too low. In both animal and human studies, ginger caused central nervous system depression and arrhythmia among a small number of individuals. 3. May aggravate gallbladder disease. Research shows that ginger increases bile secretion, which might contribute to gallstone formation in some people. If you have gallbladder disease, it's recommended you use caution when consuming ginger, and discuss its usage with your doctor. 4. Allergic reactions of ginger. As with almost any food, allergic reactions to ginger are possible. While uncommon, a possible external allergy symptom to ginger is contact dermatitis or eczema. There are also cases of allergic reactions to ginger dust, such as that from powdered ginger. However, no skin prick test currently exists to test for ginger allergies. If you think you might be allergic, the best course of action is to avoid ginger. 5. Can prolong bleeding. Warfarin is an anticoagulant blood-thinning drug, given to people with known concern about blood clots and before certain surgeries. Research suggests that some foods, including ginger, potentiate the effects of warfarin and increase the risk of bleeding during surgical procedures. According to the Cleveland Clinic, though, small amounts of ginger, think seasoning, not a major component of your diet, should be fine. 6. When taken by mouth. Ginger is likely safe when taken appropriately. Ginger can cause mild side effects including heartburn, diarrhea, and general stomach discomfort. Some women have reported extra menstrual bleeding while taking ginger. 7. When applied to the skin. Ginger is possibly safe when applied to the skin appropriately, short term. It might cause irritation on the skin for some people. 8. Medication given during pregnancy. It's important to weigh the benefit against the risk. Before using ginger during pregnancy, talk it over with your healthcare provider. 9. Children. Ginger is possibly safe when taken by mouth for up to 4 days by teenage girls around the start of their period. 10. Breastfeeding. There is not enough reliable information about the safety of taking ginger if you are breastfeeding. Stay on the safe side and avoid use. 11. Bleeding disorders. Taking ginger might increase your risk of bleeding. 12. Diabetes. Ginger might increase your insulin levels and/or lower your blood sugar. As a result, your diabetes medications might need to be adjusted by your healthcare provider. 13. Heart conditions. High doses of ginger might worsen some heart conditions. Uses of ginger. There are lots of different ways to use ginger in cooking and baking. Some of the most popular ways to use ginger include: in a juice or smoothie, in baked goods, in breakfast foods like oatmeal, overnight oats, and chia puddings, in sauces and dressings, teas and medicinal drinks. Special precautions and warnings. Pregnancy. Ginger is possibly safe when taken by mouth for medicinal uses during pregnancy. But using ginger during pregnancy is controversial. There is some concern that ginger might affect fetal sex hormones or increase the risk of having a baby that is stillborn. There is also a report of miscarriage during week 12 of pregnancy in a woman who used ginger for morning sickness. For pregnant women, it is suggested that ginger can be used safely for morning sickness without harm to the baby. The risk for major malformations in infants of women taking ginger does not appear to be higher than the usual rate of 1% to 3%. Also, there doesn't appear to be an increased risk of early labor or low birth weight. There is some concern that ginger might increase the risk of bleeding, so some experts advise against using it close to your delivery date. As with any medication given during pregnancy, it's important to weigh the benefit against the risk. Before using ginger during pregnancy, talk it over with your healthcare provider. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.